Thank you so much for joining us today. My name is Lily Talcott. I'm a Master Educator with the Ithaca City School District. And today we are here to talk a little bit about the Ithaca City School District CPSE, or Committee on Preschool Special Education, to CSE, or Committee on Special Education, transition. We're so glad that you're either watching us live or you're watching us afterward. Thank you for joining us. If you are watching it live, you can comment during the broadcast, either just right at the bottom of the YouTube video. So there's a little comment section, so I'll be watching those. Or you can comment directly on our Google Plus page. So why are we doing this panel today? We are doing this because we want to clarify how this transition will unfold this year, and to give folks an opportunity to ask questions in this open forum. Our really loose learning target today is I can explain the components of the CPSE to CSE transition in the Ithaca City School District. Now I'm going to turn it over to our panelists. They're just going to introduce themselves, say their names, where they work, and what their roles are in the district. Let's start with Lisa.
Hi, I'm Lisa Bontempi, and I'm chairing the Committee on Special Education and 504 in half of the elementary schools in Ithaca. That means Northeast, BJM, Fall Creek, and South Hill.
Sheila.
My name is Sheila Murray, and I am the CSE, or Committee on Special Education, chairperson, and also the 504 chairperson for the elementary buildings. That is Enfield School, Caroline, Bell Sherman, and Cayuga Heights.
Teresa.
Hi, I'm Teresa Vossen. I am the chairperson for the Preschool Special Education Committee, otherwise known as CPSE, and I work in the administration building in the Early Childhood Office.
Thanks. So I'm going to ask each of our panelists a question, and we'll give them time to respond, and then each of them may join in and add some additional comments as well. So the CPSE process for determining eligibility for preschoolers with disabilities is put forth by the state, and it's pretty clearly defined. Teresa, can you talk about what this process is like, please?
Sure. We have 2 points of entry, I would say, like just as a way to think about it. So we have kids who are transitioning from early intervention services into preschool special education services. And just to clarify, oftentimes people think that if they're getting preschool special education services, their kids are going to preschool somewhere. Just to clarify that preschool refers to the age of 3 to 5, not necessarily a placement. So that is often a confusing factor. So that being said, when kids come from early intervention, we transition their services, and they have to have a meeting before their age of 3 in order for their services to transition seamlessly. If kids come who have not been in early intervention, they can come at any age any time between the ages of 3 and 5 and be evaluated. The evaluation process in both areas requires, I should say, some form of cognitive testing within a year or so. But if we don't have we don't necessarily have to stick within that calendar year if we have enough information to show that they're still at the same level, and we can use their current level of functioning to determine the need. And then they also need to have some medical information, background, a medical report, a social history report, and then a report typically from the area of concern, but most of the time the psychological covers cognitive, doing some screening for fine motor and visual motor, and also some screenings for speech and language. So we determine eligibility based on 3 things that are very clear for early intervention for CPSE that may not be for other places. So I'm going to hold this in front of the camera and kind of sort of see how it takes. So there you can see the three, hopefully you can see that more clearly than I can on my screen. So there are three things. One is a year delay. Can you see this okay?
Yeah,
okay.
Thanks.
Sure. A year delay or a 33% delay and or 2 standard deviations from the mean of levels, or so if you're considering one area of service. If you're considering 2 areas of service, it's 1.5 standard deviations from the mean. So we use that to help us consider eligibility. We also factor in how the kids are functioning and whether or not sometimes kids might have average skills, but if their functioning levels are not the same as their skills, we can still provide them some service. But that's not actually, it's not typically the norm, but it's another area that we can consider in terms of determining eligibility. I think that is somewhat comprehensive, unless Lisa and Sheila would like to add some things that I may have forgotten. Okay.
Thanks, Teresa. That's helpful. So determining eligibility through CPSE is different from the process at CPSE. So, and you highlighted some of those things, but I'm wondering if, Lisa, you could talk about the categories of disability then under IDEA, which is different from CPSE, and talk a little bit about determining what determining eligibility looks like at the CSE level.
Sure. In special education at the school age level, we're required to determine eligibility, and once a student is determined eligible, we need to choose a classification from a list of 13 different classification titles or labels, which is different from preschool. Preschoolers are called preschoolers with a disability. But when we get into the school age realm, we need to choose a label that really reflects where the greatest area of delay or disability is apparent in the student and how it's impacting their education. Those range from autism, deaf and blindness, emotional disturbance, learning disability, hearing impairment, multiple disabilities, other health impaired, speech and language impairment, traumatic brain injury, and visual impairment. I think I might have missed 1 or 2. And when we look at eligibility, and Sheila, my counterpart, you can help me with this one, we look at, does the student really show either some significant delays in a certain area that requires special education, which means a specifically designed instruction, specially designed instruction for a student that could include a number of accommodations, modifications, equipment, technology, structured task, structured teaching, pre-teaching, reteaching of skills. Sheila, did I miss anything?
No, I mean, basically, if a child is eligible under the Committee on Special Education, we would determine which area or which classification is appropriate, which you've explained, and then from there we develop goals, and then those goals help us to make recommendations as far as programs, services, and the accommodations like Lisa was mentioning.
Thank you.
Great. Was there anything else that you wanted to add to that?
Yes. Also, much like, or as the same process with CPSE, an IEP is developed for a child, individualized education plan. Those are reviewed yearly at an annual review. We look at service delivery, progress towards the goals on the IEP, and how the child has progressed. And if we need to meet more than 1 time a year because there needs to be some changes, there is a mechanism for that rather than waiting 1 time a year.
Great. Thank you. Thanks. So testing is something that we've talked somewhat about as well, so formal standardized testing and what's necessary through CSE as well. And Sheila McHenry, our director, our wonderful director of special education, has just shared some some straightforward guidelines for this year as far as initial evaluations for CSE, and she simply stated that an initial evaluation for CSE must include at least a physical exam, an individual psychological, if one done by CPSE, must have been done within 3 years, a social history, an observation of the student and the student's learning environment, and other appropriate assessments or evaluations, including a functional behavioral assessment for those students whose behavior impedes his or her learning or that of others as necessary. So she's just provided some clarity around the type of assessment. So as we know, some students are determined ineligible through the CSE transition process, that transition from CPSE to CSE. What are those students who are determined ineligible, or what about those students who are determined ineligible through CSE, but who may need some additional support as they move into kindergarten? And Sheila, could you talk a little bit about this and provide us some insight there?
Sure. Well, each building is a little different, but typically at the CSE meeting where we are determining eligibility, there are members there from that home school who are familiar with the response to intervention or RTI process within that school. If RTI is appropriate for a student, that member of the team would address the questions that the parent might have, but that would not be something that as you know, a Committee on Special Education chairperson that I would address. Our goal when we get together as a CSE is to determine eligibility, and if the student is determined eligible, we then create the IEP or individual education plan that Lisa was referring to. If they're not eligible, the CSE would make that determination, and then the CSE meeting essentially ends at that point. And then that member or members of the CSE who have been appointed as the spokespersons or I guess spokespersons for that building, as far as how the child will be supported through RTI supports. Great. That answer your question? Okay.
Yes, that was great. Does anybody have anything else to add to that?
No.
Maybe just to explain for folks who might not know what some of those supports might be.
Well, again, I'm a Committee on Special Education chairperson, so I mean, I can speak to what I've observed, whether, you know, again, it looks different in each building. Related services, such as speech and language support, I have seen students receive that support through RTI. I've seen students receive different levels of support as far as occupational therapy. It could also be reading teacher support. Some buildings have a math teaching assistant or an aide. Actually, it's an assistant or a math teacher. They might be providing math support. Let's see. You know, I think. Go ahead, Lisa.
There's short-term interventions that data is collected over time and looked at, you know, regularly to determine if the interventions were effective. And if they aren't, that the intervention should probably shift and change, and you know, keep tracking progress monitor.
Right. There are committees, just like we're a CSE or a Committee on Special Education. There are RTI committees that are made up of the building level staff, and the parent is part of that.
And I would add that even though it looks different across our 8 elementary schools, Lori Bruce Jowo has been sharing with principals a process that was developed by one of our school teams between pre-K and school age, just an RTI protocol to help ensure that those kids don't get lost in the shuffle and lost in that transition. So I know that is something that folks are working on. So great, thank you. So for many of us who work in pre-K, we know the students that we're referring to CSE very, very well. What's your best advice for preparing for a meeting? And even though this seems a little backwards, we're going to start with Teresa and then have folks jump in.
Okay. Yeah, so going backwards, no, just thinking about preparing, first of all, it can be somewhat of an emotional experience for providers to go through, and speaking from as being a previous provider, we worry about those kids that we're sending forth. However, there's really no need to worry because we have really solid programs in our classes, but it's okay to worry just because, you know, we have to say goodbye and watch them go on, and also know that they've made great progress while we've worked with them, and knowing that they'll continue to make progress as they go on. So just sometimes it can be somewhat of an experience that can be anxiety provoking for us. The other part, though, is so keeping that in mind, it's good to prepare by just sort of putting your thoughts in order and writing your report. The tricky part is when you get to the meeting. So I've been on both sides of the committee. Now that I'm facilitating meetings as a chair, I see things and I see how I could have done things differently as a provider. So that's the part that I'm sharing now. So making sure that we share the air. We have a very short period of time to discuss, especially for kids who have more than 2 services, all of their needs. And there's a lot of people that often need to go. And then we have to determine eligibility. And then we have to come up with the level of service and the frequency of service if they are eligible. So there's a lot that can go into a very short period of time. So really being mindful coming in about being concise, but also being able to be elaborate and articulate enough about who this child is and what they need. And if you just focus on the present levels within the IEP, that will help you to, as I was once asked by a principal, to just give the Reader's Digest version, because we don't have a lot of time to do to get into a lot of discussion. So that's just something to think about. And I wasn't always good about that, as you can tell, given that that's what a principal asked me to do. So the other part is, on that same note, while we really do want to see the kids that are coming to the table, and we're there for the kids to talk about, it's important that if one picture is okay to bring, just so we can maintain the focus on why we're at the table. But sometimes videos can be distracting to folks, and as much as we like to see the kiddos, it's hard to focus on a meeting in a very short period of time and regain that focus. So that's just another piece to sort of think about. Let me see. The other part is just to remember it's not a parent-teacher conference. We have a goal, which is eligibility. So during the time we're being concise, it's also important to remember while someone else is reporting out on the progress, it's important to just let them report. The chair will ask questions, but really just to be mindful, because we can't allow for a lot of discussion when it's not time to discuss. And I feel like I'm sort of being like a rule, asking people to do sort of rule-y kind of stuff, but it's really just to help us be able to focus and move through the meeting so that we're focusing on what the child needs for their transition. I think that's enough for now. I'll pass it on.
Great. Thank you. And I appreciate your honesty. I think we all appreciate your honesty and your humility there, saying you've been on both sides of the table, and giving that Reader's Digest example, I think, is helpful. Lisa, Sheila?
Sure. I agree with everything that Teresa said. There is so much information that we need to gather and discuss that it's not that we don't want to hear every detail of how well the child is done in preschool. Preschool is, as somebody who was a pre-K educator and still is, the staffing is a little bit higher. In the past and historically, there's been more adults in the classroom, and most of the services are provided within the classroom. So the individuals get to be very compassionate and passionate about the child and advocating for them. as they move on. And sometimes there's a fear that the class sizes in kindergarten are bigger and they won't get the love and attention. And we see the same kind of transition concerns or worries when kids leave middle school and go to the high school, or kids leave 5th grade and go to 6th grade. It's our protective teacher instinct, but all for the right reason. In preschool, though, you've watched the kids grow and mature with the supports that have been in place if they've been receiving some for a long time, and you feel that you are the first real educators for those kids. Aside from the parents, that's true. And now when we get into the school-age situation, as much as we want to have every picture that the child's drawn put out at the table in the videos, that's great, but because preschool is pretty regularly communicating with the families, or at least for the most part when I was a pre-K educator, I know that's pretty typical with home visits and such, that we really have to get to the meat of the meeting in terms of eligibility and then what supports need to be put in place. So we appreciate, without being insensitive to how emotionally this could be as a meeting for the family and providers, but we do ask that we can move it along because we're often scheduled back-to-back for 5 hours in a row. So,
Thanks.
Sheila?
Sheila?
Yeah, I think one of the things in thinking about preparing for a meeting is to review the classifications that Lisa talked about. There are 13 classifications. When you're writing your report, it may be helpful to also keep that classification in mind. What we're looking for at the meeting is data and information to help us as a committee understand the strengths as well as the needs of a child, and then to use that information in determining which classification the student might be eligible for. So to come into a meeting and not really have a sense of which classification you feel a student may be eligible for can make for a more cumbersome conversation and not as data driven. So that would just be a recommendation that I would have. And then as far as reports, we import the reports, which is great. Some of us project IEPs, so we can project information up on a screen during the CSE meeting. Also making sure that the PLEPs are updated. If a student had, let's say, their annual review back in November and under CPSE, and here it is May, to have updated PLEPs to demonstrate the progress that the student has made is really important, because again, that's the data and information that we're going to be seeking and using to determine eligibility.
Thank you. Thanks. This is helpful. I feel like it's coming together a little bit more, and I think it's helpful for those folks who are watching or who may be watching later to hear all of this, even if they've heard it before. So we have both a district committee on special education, and we also have building-based committees. Can one of you, Sheila or Lisa, just talk briefly about the clear distinctions between the two of them?
Do you want it, Lisa? Go ahead.
Go right ahead.
No, really, you could.
No, go ahead. I think we can piggyback.
Okay. Well, the District Committee on Special Education always has the school psychologist on it. It is considered a full committee on special education. The building level committees are considered subcommittees. We have school psychologists in the meetings as needed. It would be dependent on the needs of the student and the type of meeting that we're holding. Typically, the students at the district level, or as people in the district would say, Catherine's committee, Catherine Arnold is our district committee on special education chairperson, tend to be kids that are higher needs kids, kids that might have a little bit more complex individual education plans or IEPs, students that might need more restrictive accommodations or related services such as one-on-one aids, equipment. So, Lisa, do you have anything else you'd add? Or?
No, and sometimes a child will be sent back to the building level CSE if their program looks pretty secure. Sometimes transition at the beginning of the year for a child might require the district to look a little bit more closely at the intensity of the student's needs, but there are many times where Catherine will say, I think this child's program is comprehensive, and I think we can send it back to the building level to review from then on.
Yeah, that's a great point.
I just also want to add that, Catherine, when we know kids are going to private schools, she also, like most kids who are going to private schools who may be considering eligibility or who have an IEP, she typically chairs those meetings, as well as, like Sheila said, for the kids who might require aid time and like special technology beyond just some typical things, which is kind of hard to describe, but just for that piece, it's sort of just a way, it was a way for me to sort of remember who goes where for what, just if I remembered a few key points of sort of those people she sees, or, you know, the committees or meetings she chairs.
And also just a point of information. In the past, a parent member was required to be a part of the Committee on Special Education, a parent who has a child or had a child with a disability, but that's no longer a required component of the team. If a family member feels that that's somebody that they would like, or the school psychologist, they can always put that, the school, physician, sorry, long day. They can always put that request in writing, and we can try our best to accommodate that need.
Thanks. Much appreciated. So I'm going to give our panelists an opportunity, if they would like, to make any closing comments, say anything that they feel like they weren't able to say beforehand, that they'd like to be sure to get in. Ladies, anything additional that you'd like to add? It's okay if not.
I can't think of any.
Okay. I'm good.
I think I'm good.
Great. So I want to say thank you to Teresa, Sheila, and Lisa for your time and your dedication and your commitment, and for helping us clarify this process more. Folks, if you are watching this now and you want to share this with other folks, if you're on our district homepage, if you click on staff, either on our district homepage or on any of the school homepages, again, just click on that staff tab, and you can see the professional development page is one of the links there for the staff page. And you can click on that and you can view this and any other of our archived online professional development sessions through Google Hangouts on air. So thank you everyone who was our wonderful panelists. Thank you panelists. And thank you viewers. And have a wonderful day. Adios everybody.
Bye-bye.
Bye.